The hardest part sometimes was asking a hygienist to change something because it was always
what?
It was always, we don't have time for that. We can't do it. It was we can't. Like the first response is we can't.
Bringing in the whole team to collaborate together can get you your better result as opposed to, hey, you didn't reach your goal. Hey, you didn't reach your goal.
Mm-hmm. We're hoping to bridge the gap a little bit today between the back and the front of the dental office.
Having really that team approach, that team mindset from the beginning and not just throwing it at.
How can we...
Welcome to the Wisdom Dental Podcast, a new era of dentistry, where we peel back the layers of a running modern dental practice. From real-world stories to smart solutions, we're here to help you build a thriving business and deliver care with confidence. Let's get started.
Hello, everyone. Welcome back to another episode of a new era of dentistry. I'm so excited to have today's special guest. It is my sister, Lauren Stanford.
Hello. I'm excited. Back to the old times.
It's going to be fun. And for those wondering, why is her sister on here? Well, Lauren happens to be a sales director at Wisdom, but also a former hygienist. And there was a time that we both, with my other sister, worked at my father's practice at the same time. So we're going to hope to share some of those stories today with you. But the goal today is to talk about how Lauren, who is a hygienist, how hygiene impacts dental billing. So share this with your hygiene friends, your clinical teams. We're hoping to bridge the gap a little bit today between the back and the front of the dental office. Lauren, are you ready to get started?
I'm ready. Let's do it.
So I sent her some questions, but to be warned, we have not prepared because we want this to be authentic and genuine. So we are just going to go from the hip and give you our expertise right now without really practicing. So I think you're going to walk away, though, with a lot of tips. So I'm excited.
Wing it.
All right. So first question, Lauren.
Yes.
Do hygienists realize how much influence they actually have on whether claims get paid or denied?
I'm going to say no, just because I don't know if there's a whole lot of communication between when the claims do get denied. So I think just unless you're sharing this as a group with the office together, I don't know if they really know how much of an impact they do have on getting their claims paid.
Yeah, I just spoke in New Mexico, and part of the conversation was about reviewing denials monthly as a team. That's not something that we did in the office.
No.
But I feel like we're a small office, so we over-communicated anyway I guess, let me ask you, as a hygienist, when I was working up front and you were in the back, do you remember the denials that came in when it was like on y'all? Not on y'all, but like a hygiene appointment.
I think our situation was a little bit different because, I have some control issues. So I think in our regard, yes, just because I would almost take it personally.
Yes, you would. Yep.
And then we'd kind of talk about that. But I don't know if we had that with the rest of the team.
That's true, because we would work up appeals together for scaling and root cleaning, or when they denied, remember, I'm not going to say the name, starts with a B.
Yes, I know who you're talking
Somebody's perio maintenance. Oh my goodness.
Yes.
And we were fighting for so long with that insurance company.
Yes.
There's another patient I remember too.
Oh yes, I see them. They're in my mind.
They're in
right
my
now.
head.
Yep.
HIPAA, we can't say.
Cannot say, but yeah.
But I think, so when I spoke at New Mexico, I talked about review denials monthly as a team, because I don't think the clinical team a lot of times has any idea of what's being denied and why it's being denied.
Right.
And a lot of the times it seems like billing is a front office job when really it takes the entire team.
Absolutely.
The front office team, they can do the checks and balances to get the claims paid, but they cannot do what is necessary for clinical attachments to get the claims paid. That's all on the clinical team.
Correct. And even, when I would start talking about me geeking out on all perio and,
she loves her perio.
You just kind of roll your eyes and just be like, okay, that's enough.
She's very passionate about perio.
Yes. And a lot of us hygienists are. Because we do really care about our patients. We want to do the best treatment for them. So I do think it's a great idea, kind of involving the whole team. You would be surprised, probably not, at how many hygienists have that passion, that crazy passion, like I did, to help if they were in the know.
Yeah. And so this isn't one of my questions, but I said we're going rogue
Okay.
today. Sorry. But we hear this all the time, especially at conferences or in Facebook groups, SRP being denied constantly. So
Yes.
before we even get like into it, let's just call out, why is SRP, I want to say let me say from my perspective,
Okay.
why SRP is being denied.
Yes.
I have no clinical experience except when I was forced to go back there.
Which was not often.
I'll say why I think it's being denied. Granted, we had a very good perio program, a lot because of you. And then Kendra Sellers was a big influence in our office.
Amazing.
For our perio program. But I'm going to talk about why I think it's denied, and then you tell me what I'm missing.
Okay.
And then what hygienists could do, because it really is both the hygienist and the front office team member to make sure the claims are paid.
Yes.
So from my experience, why I'm seeing SRP being denied a lot is any claims that are going to be denied is usually because they're being overused when they shouldn't be. So like, for instance, buildups started to become more and more denied because a lot of dentists started to send a buildup no matter what with every crown. Not saying that your office isn't doing SRP because it's needed, but what I think is happening is there might be some patients that there's not the clinical evidence that SRP is needed. So they're denying a lot more because a few are doing it the wrong way, and then it's hurting everyone doing the right way. And what's needed to be seen that's not always being seen is especially the FMS, a pano and bite wings, PAs. That's not what they need. They need a full set of x-rays that show clinical bone loss on the x-rays. And if it doesn't show the clinical bone loss, it has to be in the clinical notes. And I think clinical notes all around are missing art in dentistry with dentists, but also with hygienists, and that we need to up the game when it comes to clinical documentation. Now, what do you see from your perspective?
I do agree with what you said. I do believe there was a span of time, and it may be still happening now, that SRP was being maybe used for more, 4mm pockets, no radiographic sign of bone loss. And in my opinion, that's just not when I would recommend SRP. So there's a couple of things that are needed. Yes, a full mouth set of x-rays. The other thing I love to add in there is those vertical bite wings, because they show the bone level just so well, and making sure you have just all the documentation. I think that for a while, like I said, offices were maybe overusing that code. So insurance has gotten very strict, and SRP is a very big one right now that they're rejecting and denying. So I actually made an SRP checklist, because what happened to us is, when Dad retired and we had another doctor come in.
Right.
So I never changed anything with anybody I recommended SRP, but all of a sudden all my SRP was denied. So I had to really get strategic and, kind of change the game of what I was documenting. So going back, quality x-rays are huge. Clear periodontal diagnosis, classification.
Staging and grading, which, not gonna lie, I don't know what I know what it is.
It's like, oh my goodness.
I know there's
She's been listening.
There's like an ADA sheet about staging and grading. I wouldn't know how to stage and grade someone, but I know that's important to do it.
Yes. And I am a firm believer in templates. If you can make it easier, that is the goal. Making sure you have a full periodontal chart. Please, please, please do this as just your best practices anyways. Have bleeding on there, have recession, have mobility, have furcation involvement. And then I always like to put in there, I would take every CDT code and pull something out and be able to add that in my clinical notes. So I would put the therapeutic purpose of the need of the treatment. So it was no longer in maintenance mode. We were no longer maintaining. We were absolutely having to do a therapeutic treatment to help them not lose more bone. One of my biggest firm believer in this, intraoral photos.
Yes.
Please, please, please. And my thing with intraoral photos is, healthy tissue is not going to have that rolling active infection. Can I tell them?
I'm not a flosser, guys.
Don't even.
She's tried to get me to floss.
I have had to move on.
And I would like to state for the record, there was a week this year that I flossed. A full week. I thought it was going to be forever.
You have so much control over inflammation.
I know. You really should floss. For everybody out there, please floss. Please. You should floss. I know it. It's just hard to remember, and it hurts.
Set an alarm. Set an alarm.
I know.
It helps. But I would say, so healthy tissue, somebody who's flossing, you're not going to have that active infection. So one of the things I did, because I thought it was so great to show the patient and also to send with my claims, is take my instrument, kind of go alongside the tooth. I would get rolling infection, especially if the tissue was really bulbous.
Which means rolling blood.
Yes,
for those that we sure. So like when we did when they did their hygiene treatment, they learned like those keywords of like calling it infection for us layman's
not a little bit of
terms.
bleeding, not
It's the rolling bleeding.
It's yes. And so I'd snap a picture of that. And first thing I would do too is show the patient, and they were like, what? Because they don't see that. And then you better believe that's going with each of my claims. If I'm ever doing something over a prophy, going with every single claim, intraoral photos every time.
Yes. And I'm a firm believer, say this in a lot of my presentations, the intraoral camera is one of the greatest tools you can have in your office.
Yes.
The reason I say for case acceptance, for marketing before and after photos, but also insurance denials. And it doesn't have to be, it used to be so expensive. Dad, we used to have one.
Yes.
Because my dad also was, cheap isn't the word, but like where cost conscious.
Yes. Yes.
So he would really pay attention. Of course you have to, especially when you have such high overhead. I get it now. Now I see running a business in a different light, especially in dentistry when you have such high overhead. So I get it now. But that's when intraoral cameras used to be the big, like such a big investment. Now they aren't. So you can have, I think you can find some for $200.
Yes.
And you can have one in every operatory. I promise you it'll pay for itself. We did a contest once. I call it a contest, but I used to come up with contests that then they were actually just rules. And there was a contest of a hygienist. Remember, you guys had to take an intraoral camera at every visit, no matter what.
Every visit, no matter what.
Just to get them in the habit of taking a photo at every visit.
Yes.
And I don't remember like if anyone won.
No, we didn't.
Anything. It was really just a rule.
I got so mad.
For a month.
Yes.
And I would be like, you didn't take your photo.
And then we'd get talked to by my baby sister, who was always my boss. It was so fun.
It was some good times. Really
it was some great times.
But I think if you don't have it, not I think, I know.
Yes.
If you don't have an intraoral camera, use it. If your hygienist team or even your assistants aren't using it on a daily basis, I think that's where training can come in handy. We would always do what my father would call each one teach one.
Teach one.
Each one teach one. Did he make that up? Is that a thing?
I don't know, but I talk about it now sometimes.
I know, so do I.
And
Let us know. Have you guys heard of each one teach one? What did we do? It was typically, I feel like we spent a lot of it clinically.
Yes.
But it was good for me working up front. So I would go back and we would practice something. So the assistant would teach us how to do x-rays, which, by the way, I took some mean x-rays.
Yeah, when you would do it.
When I just don't like people's mouths.
No.
But when I would do it, I take a good x-ray. That made me feel really good. Impressions, not good. Cannot.
Actually, me neither. I like the scanner.
I'm not. But we would do the each one teach ones where we'd practice taking impressions. Everybody in the office, because the goal was if someone's out, anybody could come in and take someone's duties if they had to. But obviously, I'm not going to be doing clinical work. But it was good, I think, for my learning and even knowing what a good x-ray was.
Right. And it really does. It allows, maybe somebody like you who wasn't so clinically, driven to see a complicated case. I think it's a really good idea to take a case who started off, who really needed some help, show the perio chart, show what happens when they come back after their treatment, show the intraoral photos, because it just gives you guys an idea of really more than just a code, more than just a claim. Like you guys get to see the health behind it. And I think that's something that just gets that passion for everybody. And it helps you understand full circle kind of the entire office.
It's very true. Circle of life.
Circle of life.
It's very true. But I think there's something to that on the front, going to the back to learn clinical, which helped me bill better. It helped me have conversations with the patients about why they need their treatment. It was so much easier for me. They always come up and they ask you, do I really need this? Or they would call trying to cancel their perio maintenance because they don't want 4 per year. I've heard her ramble so much on why it's needed.
Educate.
Sorry, not ramble. Educate. It is you do need it. It's maintenance. You have an active infection. You need to maintain it.
Start flossing, Ashley.
It's not just a cleaning. We actually go below the gum line, stuff like that I had to know. But just as important it is for me to know the clinical side, it's just as important for the clinical team to know the front office side. So that's why I'm excited we're having this conversation. What can the clinical team do to help the claims get paid faster?
Right.
And I'm going to segue that into what is the biggest way hygienists can help claims get paid faster starting tomorrow? Let me say that one more time. What is the biggest way hygienists can help claims get paid faster starting tomorrow?
Starting tomorrow, I would say take in what you can control. And that's going to start with your clinical notes, having all the documentation that is needed, having an SRP checklist yourself, making sure that you're gathering all of this so that you know what you're doing is going to help get that claim paid. The intraoral photos, that's something you can start tomorrow. But I will say, I do know what it's like being on the end of feeling like you're there's so little time, you're live with patient after patient after patient. And that does get stressful. So that is difficult, but then, maybe not start. And this was difficult for me because if there was a challenge, I'm just going to do it. And if I don't, I fail. Maybe
sounds about right.
Right. Maybe start with a little bit of grace as, okay, maybe let's not go jump all in because we're that type of family.
We're all or nothing.
Yeah.
That's about right.
It's not always maybe the best approach.
Yeah, we go for mastery and perfection, not progress.
Not progress. So maybe go progress route.
So don't do that.
Don't do that because you'll get defeated.
That's true. Start with one small goal.
Yeah, one small goal. Intraoral photos, pick a certain amount per day and really work together as a team. Okay, why did this day was I not able to get intraoral photos on these amount of people? And really hear each other and try to come with a solution-minded approach.
Yes.
And not just the problem, because then you can work together to get that solution.
That's true. I will say the hardest thing I feel like I can give trouble to my sister who's a hygienist. I wouldn't do this to like normal people.
No, I don't think you would.
But the hardest part sometimes was asking a hygienist to change something because it was always
what?
It was always, we don't have time for that. We can't do it. It was we can't. Like the first response is we can't.
Yes. Panic first.
Yes. So how can you help someone who doesn't understand? Just do it.
Right.
I wouldn't be that way, by the way, for someone that wasn't my family. How would you help the hygiene team who does feel like they can't add one more thing? How can they make it easy to even say clinical notes?
Right.
Or taking an intraoral photo. When can they do that? Let's just use that. Clinical notes, what I want you to do for clinical notes is I want you guys to take an admin day, or for not even admin day, on your meeting day, or when you have a next cancellation on your schedule. I want you to have that time that you chat GPT how to update clinical notes and then figure out how to update your clinical notes and use the SOAP method we have on our website. Best tips for clinical notes. It is our clinical note hacks. So we'll make sure to put that link in the show notes but I want you to use those against your templates and then see, especially for SRP, if you have the information needed to get the claims paid. So we're going to do that. And if you want our SRP checklist, you're going to email info@withwisdom.com. That's one. Two, though, tactically, for intraoral camera photos, when can they do that in the appointment so that it doesn't seem like, because I know it's like, oh, I have to get the sleeve cover and I have to put the sleeve cover over the thing. And then that's another thing I have to clean. And then I have to race to get to my next person. So like, how do they add that in?
I think in looking back over the years, our approach, I was also a little reactive. It was just panic.
It was very reactive.
But it stemmed from something real.
It stemmed from probably fear of,
I don't like to be late.
Yes. So that was a big fear of being late for her next patient.
Yes. So I would say the best way to go about that is involve your team. So I would say have the first meeting. Don't just spring it on them. I think that's a really great way to set up for panic. Yep.
And my dad and I would do that.
Yep,
Like
take
starting
notes.
tomorrow.
Take notes.
Yeah, that's something I could get front office team members or office managers, dentists, maybe give them some like, hey, next month.
Yes.
We're going to start this. What do you guys think? What do you need
Right.
for us to support you in this new goal we're reaching toward?
And have them come up with ideas. Granted, have your goal in your mind of how you think it's going to happen, but be willing to pivot and kind of take in. The more I think the whole team can collaborate together, the more they feel a part of it. And
Right.
they don't just feel like, oh, here's another thing that's added. And so I would say, starting with the main issue, we're noticing this. We're noticing these claims are getting denied. So next month, the next meeting, we're going to go ahead and talk about solutions. So if you don't mind prepping ahead of time, coming up with some solutions, because we're wanting to at least start with adding intraoral photos more. And so you kind of lay it out.
That was so kind.
I know.
I would not have done it that way.
I know. I was much kinder.
Yeah, I'd be like, guys, come on.
This is what you need to do.
Stop
and please
sucking.
stop crying, Lauren.
She would cry a lot.
I was a crier.
That's a very kind way to approach it. And you probably got really good responses. And by the way, if I would have been kinder if it wasn't my family, I believe.
Oh, yeah,
I truly
have
believe.
faith that, yeah. I just think it really stems down to you never walk somebody's shoes. Granted,
It's true.
do things still need to be done? Yes, they do.
Right.
But sometimes bringing in the whole team to collaborate together can get you your better result, as opposed to, hey, you didn't reach your goal. Hey, you didn't reach your goal.
Mm-hmm.
So having really that team approach, that team mindset from the beginning, and not just throwing it at them.
Yes. And I think too, knowing the why behind it,
Yes.
because at the same time, I feel like, and tell me if you think I'm wrong here, sometimes we feel a type of, you can't tell me what to do from the business owner, like, and take out that it's dad for a second.
Yeah, I was scared.
Yeah, I know that makes it hard. But seeing just how many dentists are having trouble even making their bills and getting paid for what they're paying for the hygienist to be there.
Yes.
So if the claims are being denied and the hygienist has the power to overcome it, there is a part of me that's like, you're being paid to do your job and your boss is asking you to do this.
Right.
You know, like it's balancing the and entitlement is not the word I want to say. But you know, as
I get it.
Because even for me, if my dad would tell me to add something to mine, I had this like entitlement of like, you don't know what I do all day.
Correct.
But then at the same time, it's like, wait a minute, but you are my boss.
Right.
It's hard for us to think through it, I think, because it's our father. But if it was another person that wasn't our father, I probably would have been a lot more like, sure, of course, I'll do that.
And I think the entitlement stems from the idea that, like you just said, you don't know what I do all day.
Right.
So it comes from an internal of,
I'm not appreciated. I'm not valued.
Yes. And let's add one more thing.
You think I don't work hard.
Yes.
So it's
really getting the
that
philosophy behind how do we not set it up in that way.
Right.
So you automatically have that, well, they don't understand me.
Mm-hmm.
Instead, and that's where I do think going back to that collaboration.
Right.
Is this is the issue we're having.
How do we fix
you
it
guys
as a
help
team?
us? Can you help us?
Yes.
Because we're hardwired to want to help.
Mm-hmm.
So when you set it up in that way of, we need your help, we value you, I think it can change the conversation.
It's very true. And I think a lot of what offices are missing, and probably actually more than just dental offices, just workplaces as a whole, is trust.
Oh, yeah.
And you think everyone's out to get you.
Yes.
And that everyone's feeling like they're not appreciated. Everyone's out to get you, instead of that trusting team that actually we all want the same goals. Now, there are some just toxic places that just might not be good fits. But I'm talking about the normal average offices where it could be a place that there's trust there. Now, I don't have the solution today on like how to get that trust, but stay tuned. We'll bring that into another conversation. But I want to keep it on hygiene and helping billing. So I would like to ask you, what makes a strong hygiene clinical note from an insurance perspective? So what are some things right now that are missing, would you say, in clinical notes for SRP? I have a few I could add, but I'm going to let you go first. That is making insurance deny.
So I would say I will put in there, what type of bone loss do they have? Do they have horizontal? Do they have vertical?
That seems important.
Yes. Yes.
I don't know the difference.
The clear periodontal diagnosis. Again, going back to the therapeutic need, there is active infection.
Yes.
I love to tie in anything from their medical history.
Oh, that's a good one.
Right?
Like they have heart disease.
Yes.
They have had a stroke.
Absolutely.
Diabetes.
Yes.
Because those are linked.
Oh, you did listen to me.
Lauren,
You did listen to me.
You didn't know.
Wow.
Those are linked.
Yes.
That's about as far as I know. It's
you
linked.
did good. You did good.
Okay.
But different things in just seeing more denials, even adding in template appointment length, how much anesthetic was used.
That's a new one.
I know that is a new one. Different things like that. And anything that can support just the need of why they had to have that today.
Right. FMS, if you haven't heard it yet. FMS. And what I would do, so I also was a bit of a control freak.
No.
I feel like that runs in our family.
I think we...
It's so weird.
I was like the least... Not at work.
Yeah. But what I would do is I would see the appointments coming up and I would... So we had Dentrix, and then I would look to see if they're like overdue for their FMS. For us, we did FMS every 5 years if they were a healthy patient, 3 years if they were a perio patient.
Yes.
And then what I would see is I would see their appointments and what was set. And if I saw they're a perio patient and they didn't have the FMS in and they were due, I would just add it to them. I wouldn't ask them. I would just say,
she just added
do it. And I don't know if you like that or didn't, but ultimately the front office shouldn't be responsible for that.
Right.
But I didn't want to miss those.
And that would be something I would check in the morning too, is making sure everything kind of followed with what they were needing. Another thing that I like to do is a patient, for instance, say I haven't seen them in a while. They came back and I already knew from a couple of years ago, they were not a healthy patient.
Right.
So automatically, because we had very great insurance breakdowns. And
we did,
which would help me because
attention to detail.
As you can see, I don't like change.
Yeah.
And I don't like to be surprised.
Right.
So what I would do is, number one, let me check to see if they weren't a perio patient then, are they allowed to have a gross debridement?
Right.
Because my panic would come from if they presented my chair, they needed this, I didn't have time.
Right.
So if they came in and the measurements were just not real measurements, they had excess amount of tartar, would I already know ahead of time my plan, gross debridement. And with the code change of gross debridement in 2023, that really does help for more of that periodontal diagnosis. So I would definitely be using that a lot more.
Which I will say, so like insurance breakdown, I had some control things on my insurance breakdowns. It has to be right.
Yeah.
And complete. So, which I still believe they need to be correct and complete in order to give the patient the best estimate, because patients don't mind paying their dental bills for the most part. What they do mind is paying their surprise dental bills.
Very true.
I need to not patent that, copyright. But for any emergency patient, new patient, someone that hasn't been in a while, I am going to ask their coverage on every cleaning type. So regular prophy, their gross debridement. We did do a lot of gross debridements. If my father did the COEs, the new patient exams, if he couldn't get an accurate perio chart, we were doing a lot of gross debridements, but then also SRP. And so then we wouldn't have to, we could give the patient the treatment plan today. So we wouldn't have to say, oh, let me call you with the estimate.
Right.
It was ready, because then she did such a good job of setting them up to be ready to schedule for whatever cleaning type they needed, that if I had to say, oh, wait, let me get the estimate and call you back, the patient can lose that, like, you know, when you like leave church camp and you're ready to like take on the world. Like that kind of, you don't want that to go down and then they don't schedule. Like while it's hot, get them scheduled, which to get them scheduled to actually accept and keep their appointment, you have to collect the money. So just because you're scheduling someone on the books, but if you're not going over their treatment plans or if you're not collecting their portion, you are producing, you're not collecting. And we want to focus on collections, not productions, because yes, you want a high production, but if you can be producing a whole lot, but if you're not collecting it, all you're giving is the doctor more overhead and not enough collections to pay for it. So it actually is worse for the office. So focus on your collections, not your production.
Yes. And I would say make sure too, like what we just set up before of not having that full breakdown ahead of time. You get trapped in the, I only have time for a prophy, even if they don't need it. And that's where you're just not treating the health. You're not treating the health. You've set this patient up that they're just getting a regular cleaning, and it is disastrous to your office, to your production, because it's not what they need. And you know that, you just don't have the time. You don't have the plan. You don't have the system.
Right. So what would you do in that situation? So say you have a patient that comes in, they schedule an hour, which I also would mess around with her time because I wanted to keep on the schedule. And if you only need 40 minutes for perio maintenance that need nothing else, like don't extend it an hour. We could fit something in.
You were so bad.
I was really weird with that. But say we schedule an hour for someone that hasn't been in 2.5 years.
Yes.
Our process was if it had been 3 years, they would become a new patient again. But say it was 2.5 years, you thought they might be meh. They come in, they need SRP, or say they need a gross debridement.
Okay.
But you're 30 minutes into the appointment. I don't know how long it takes to do a gross. They need a gross.
Right.
Gross debridement.
So what I would honestly do in that scenario.
Do you start it? Do you have them come back?
Because I'm going through I was crazy with going through my schedules. So I already knew that ahead of time. So I already had my plan ahead of time.
She did have a plan ahead of time.
Because
so
again,
plan ahead of time.
Plan ahead of time. I don't like surprises. I don't do well in them. So for me, if I already knew 2 years, I already knew they were kind of unhealthy to begin with when I saw them 2 years ago. Not quite perio maybe. They came in, again, I already was ready. So I went in, I gathered the necessary x-rays. I got all their diagnostics up to date. Typically would take me about 15 minutes.
Way to go, rockstar.
I got faster. I had
so you
somebody
get
breathing down my neck. No, I'm just kidding.
So you get the data, the data collection.
Yes. And then I go ahead, let him know I'm ready for an exam whenever he can come in. But you better believe I already had a plan of action. I was going to do a gross debridement that day. I was going to have them come back in 2 weeks to reevaluate, tight interval, and that 2 weeks to see how much healing, to then be able to indicate, are they indeed perio? Were they just someone who, it had been a while?
Just needed tune up.
Yes. Yes. But the recare was something I would always be able to change. You guys gave me the ability to do that because unhealthy tissue should not be treated like a regular prophy.
It's true. And she did really take control of the system. I remember a flow chart because we, did a lot of gross debridements. So we had a flow chart. It was gross debridements. And then had a little.
And then 2 weeks later. It would either be SRP or regular prophy.
Yes.
Yes. And it was for the health of the patient.
Which a shocking amount, because you think like, oh, this is going to be scaling root plan, but a shocking amount went to prophy.
And even if they still had maybe 2 areas of a 5 millimeter pocket, still didn't see significant evidence of bone loss on x-ray, I kept them at a shorter interval for their recare. I did laser therapy.
Right.
So we kept an eye on it.
Yes, and she would do a lot of what we called prophy plus. So someone that didn't have that bone loss, wasn't a SRP candidate or a perio candidate, but they would do well. I was a prophy plus for a little.
Yes, you were.
Where we recommended an additional prophy. So this could be whether you're pregnant and just should have additional prophies, which sometimes you can get insurance to pay.
Yes.
Because of that. Or because they just didn't have healthy gums. So a candidate like me would do well coming in every 4 months instead of every 6 months. So that is another way. It just all comes down to the communication. You did do a really good job communicating the perio or the risk of perio, because perio is a disease, which it does scare me. Recession, you know this.
Why does recession scare you
scares me
more than literally fighting an active infection every day?
I don't, because it scares me because I know.
You would just be like, can you check my recession?
I have some recession,
but
and it dings on my canine, and you said it's not like hardly any.
It's hardly anything.
But what I know, because I heard it so much, is once you get bone loss, you can't get it back.
Yes.
You can't.
You can only maintain the disease.
Yes. So now I'm so scared on getting recession because I can't get it.
It's not the recession.
It's the recession that scares me because I can't fix that. It's unfixable.
But then this is going to be a longer conversation.
I know. I just need a floss. I get it. But that hit home after hearing it so many times. And what we'd used a lot in our office, which I think everybody should, those Casey videos.
Yeah.
So the Casey was a Patterson product. I don't know if they still do it. They might. We should probably get sponsored. Patterson, love our Casey videos. It's CAESEY.
I don't remember.
Something like that, spelled a little different. But these educational videos that we would show patients on why perio was necessary, the Velscope, crowns. But I would watch them as someone that didn't know clinical. And I learned so much from watching these Casey videos, especially the oral cancer one.
Oh, yep.
That's why every
time,
every appointment, she would have to Velscope
and in between appointments,
because I was so scared.
Can you look at my mouth?
You know how many people have oral cancer?
Yes.
And you don't have to have any of the lifestyle factors.
Yes.
It is like very up and coming for young people.
But yeah, you won't floss. It's okay.
It's okay. We all have our things.
We all have our things.
So do you find, I've only worked in physically in one practice, my father's practice. Do you find, or do you think there's still this front versus back mentality?
Oh, yeah.
Or is any of that getting better? I would love to hear too what the audience thinks in the comments. Like, do you find the front versus the back? How can we merge the front versus the back? That it is like teamwork makes the dream work, instead of like us versus you, or you have no idea what's on my plate, you have no idea what's on my plate. Like, how can we work together?
It starts by coming together, making sure you're having meetings, number one.
That's true. Every morning have a meeting, every month have a meeting minimum.
And have your goals. But also something we weren't great at, you guys kind of stunk at it, is celebrating when people are doing well. That's free.
Excuse me. I would like to acknowledge that this was not a strong suit of mine.
No.
But whose idea was it to put the whiteboard in the back that we would write celebrations to each other? While it was not my strong suit, I was much better than my father.
Oh, yeah, he struggled.
And it's not my natural inclination, because I don't like words of affirmation.
Live by words of affirmation. But yes, it comes in different, and that's the thing we have to realize is we're all different.
We all have different love languages.
We're all different, but collaborating together and looking at it from a team approach. Number one, why did we get into this field? We were kind of dragged.
I say,
but
I didn't have a choice.
I loved it. Second is most people get into it because they want to help. They care about people's health. And so having that be your goal,
that's
your
why
mindset.
You stay, for sure.
Yeah. And just working from there and working together and really hearing each other, but still getting to the end goal of, okay, we still need to do this.
Right.
But having grace.
That's so true.
Yeah.
Because at the end of the day, we do this. People want to enjoy what they do.
Yes.
I hope that everybody wants to enjoy what they do and enjoy who they are with when they work. I mean, you're with your work family more than any other people, typically. And so we all have that in common. We all want the best for our patient, hopefully.
Yes.
Like, that's the ultimate goal. Like, even when it comes to insurance reimbursement, granted, a little of it's competitiveness and the principle of things that they should pay, and I don't want them to win. But at the real, like, root of that is that we want the patient deserves to get the coverage. Because if not, they have to pay for it.
Exactly.
Or the doctor has to write it off. And we know from watching our dad, the amount of pressure on a business owner, especially a dental practice, is ginormous, and they cannot afford to write it off. So,
and you shouldn't have to. And that starts by us. And you would not believe, side note, how many of my perio patients were the least likely to ever change their appointment, cancel.
That's true.
Because we put so much into them and getting them healthy.
It's very true. Our perio program, I would like to say it's one of the best.
I'm going to go there.
Oh, the
okay,
best?
That made me nervous.
Okay. It's too much.
Maybe not.
But we had over, you want like 30% or more of your patients to be on perio?
At least 35%. So if you don't know your perio percentage.
We were over 35.
Oh, yes.
If anything, I feel like for a while, Hygiene was producing just as much as doctor's schedule.
We were doing great. We had Kendra, thank you again. You're amazing.
Shout out Kendra Sellers.
Yes. But it was great. And we were helping people.
Right. And we were getting them paid. Granted, that was before. I know things are a lot harder.
Yes.
But if you are treating patients for what they need, and this is also important, don't change your treatment dependent on if insurance will or will not pay. That's not what we're ever saying. So if insurance won't cover SRP, it doesn't matter.
Right.
You don't treat them different. You are a healthcare professional, and you need to treat off of just what you diagnose and what is the best for the patient. Obviously, working together with them, they obviously need to accept it as well.
Right.
So you might have to give options. But then after that, don't ever change your diagnosis. But insurance should pay for the work that's being done. But if not, again, just having those conversations with the patient, having the insurance breakdown ahead of time so that they know if it's not going to be covered, they know what to expect and to pay a time of service. That's what I'd like to do up front. It's all about the collections on my end. The clinical team should focus on their production, but then also part of it, making sure it's being collected at the end of the day.
Exactly. And I'm very much transparent with all my patients. If I knew insurance would not contribute, I'm giving a treatment plan, estimating insurance won't contribute.
Right, always.
And then they're still usually accepting it because it wasn't a surprise. It wasn't me trying to get them to do something. It's that trust.
Right. And you don't want to trick them and like acting like insurance is going to cover it and they'll be like, oh, they'll deal with it up front when they don't.
Right. No.
That's not a good patient experience. It's going to end up bad reviews.
Correct.
It's just never worth it. Be as transparent with your patients as you can. That's what's going to build trust. And I think too, with teams, being transparent with your own team. So if there's something that like you're not good at or you don't know, be okay with that.
Oh, yes.
We would do, when Eric and I were up front, we did a lot of role playing and scripting. Collecting money initially was one of the hardest things because at the time I'm like a broke college student. And so I had to ask people for like $1,000.
Yeah.
I'm like, that's a lot of money. So I'd be like, you owe $1,000.
I'm so sorry.
No, you don't have to pay. Don't pay us. I wonder, I should have gotten fired. But over time, it got better with practice. So we would do a lot of role playing. But then what we would do is like, because I can see, like I would sit at the checkout, Erica was at the check-in. And then after a patient would leave, if we were practicing like even scheduling, like don't say, when would you like to schedule? But instead just give them the days. I would turn to her and we'd be like, how did I do? Or, I really sucked at that one.
Exactly.
Like, be transparent and vulnerable. And even with like the clinical team, like, oh, we didn't get the oral camera we needed.
Right.
Like just being vulnerable with our failures is what builds up the team together, because guess what? We're all going to make a mistake.
We're all going to mess up. It takes practice.
I make mistakes every day.
Still,
and I'm still going to keep doing it.
Yeah.
But it's about if you care.
Yes.
To not, I care that I'm not trying. I'm not trying to forget what I'm saying mid-sentence. Just sometimes happens.
I got you.
And then you get your team to pick you up.
Right? Hopefully I did.
So what's something you want to leave your hygienist with today? What do you want to leave them with?
You make a big difference. You make a huge difference in getting, not only helping your patients get healthy, but having the insurance pay for it.
Yes.
So work together to figure out a way that you can help. I know the mindset of, it's not my job, I already have so much, but try to put that away and see how you guys can collaborate together. Because at the end of the day, it's your patients. They pay for the insurance. The doctor deserves to get paid.
Yes.
So working together is how you're going to get there.
It's very true. And you have the relationship with the patient.
Yes, they trust you.
They do really trust the hygienist. So thank you to all of our hygienists. We know how hard you work and what you do for the offices.
I know more.
She does know more than I do. So thank you all for all you do. And if you have any questions, always you can reach out to us. info@withwisdom.com. Go to our website, withwisdom.com. There's a section for free resources. We have so many podcasts, ebooks, freebies that you and your team can use. So please look at that. And then we'll see you next time on a new era of dentistry. Bye, guys.
Take care.
Thanks for tuning in to a new era of dentistry. If today's episode sparked an idea or solved a pain point, we'd love for you to subscribe and share it with your team. At Wisdom, we're here to help you simplify, streamline, and succeed. Because let's face it, your patients deserve your focus, not your paperwork. Until next time, keep innovating, keep caring, and most importantly, stay smiling.